So can you treat perimenopause naturally? This is a question that's coming up a lot lately from the ladies I'm talking to. So today I'm diving into it on the podcast.
Welcome to She's Healthy, a podcast for ambitious women on their journey to become the healthiest version of themselves. I'm your host, Lori Aikman.
All right, welcome back to the She's Healthy podcast. I'm your host, Lori Aikman. I am a nurse practitioner. I'm the founder and CEO of Crown Executive Health, where we help busy professional women regain and sustain their energy through comprehensive hormone management so that they can enjoy the life they've worked so hard for. So if this is your first time joining us on the podcast, we focus on a lot of women's health and hormonal topics. We're in a series right now where we're talking about perimenopause. And today, again, I'm diving into natural things that you can do to treat perimenopause. Now, I do have to give you my disclaimer, my medical disclaimer. I am a nurse practitioner, but this podcast does not constitute medical advice. So make sure you consult. Take a listen, learn from the podcast, but then make sure you are consulting your doctor, your nurse practitioner, your provider before you're making any changes to your health plan. All right. So let's dive in. I just want to give you, so if this is the first episode you're listening to, we have talked about in the last two episodes, we talked about signs of perimenopause, and then we talked about what is actually going on. So just a refresher, in perimenopause, so perimenopause is the time leading up to menopause. So menopause is when our ovaries stop producing eggs each month, we stop cycling, and the average age for that is 51. Then you can start having perimenopause changes up to 10 years before that happens. So average age would be, early 40s for most women. But really this starts happening, I would say 5 to 6 years, maybe, with the closer you're getting to menopause, then the symptoms, the signs of perimenopause and the symptoms can be heightened, right? More obvious. But for those of you that are in, you can experience, they call it premature ovarian failure, early menopause, basically. If you're experiencing that, this can help you too. So if you're experiencing some of those signs that we talked about in the last two episodes, but you are not quite in that perimenopause state, still the treatments that we're going to talk about today can be beneficial for you. So, and just a review of what is going on as you are entering into that perimenopause or menopause state is you're going to have a decline in progesterone. So your progesterone comes from the eggs that your ovaries release when you cycle each month. And so as we're leading up to menopause, the amount of progesterone from those eggs, from the corpus luteum, decreases. So big takeaway is progesterone is going to decrease. The other thing that happens is we can actually have some fluctuations in estrogen. Estrogen also primarily comes from those eggs that are released when we cycle each month from the follicle. But we can, basically the estrogen can kind of fluctuate up and down before it then decreases and goes really low in menopause. So that is hormonally what's going on. And then that's going to affect the treatments that we can use during that time. So first thing, I do want to bring up some of the treatments that if we're talking about treating perimenopause naturally. So I'm going to list just some of the things that you can do to help treat perimenopause symptoms. And then I'm going to give you an invitation to something that we're doing about these. So one of the things is regulating your nervous system. So this is the first podcast episode of mine that you're listening to, you should go check out the others. But we talk a lot about how our nervous system and being in fight or flight triggers cortisol, right? Our stress hormone, and how that disrupts our hormones. So if this is happening as we are, one that disrupts our hormones when we are not in perimenopause and menopause. But then when we go into perimenopause and menopause, we're already having those hormonal changes. So then having a dysregulated nervous system that is then throwing off those things even more can be really disruptive and make that perimenopause, menopause transition much harder. So one of the things we want to do is regulate our nervous system. And like that is getting out of fight or flight and getting into rest and digest more often. So like doing those calming things. My big one I talk about a lot is breath work. I love breath work. We also want to, when this happens, when our nervous system is really taxed, it can actually affect what is called the HPA axis. So our hypothalamic pituitary adrenal axis. I see this a ton in the women that I work with in my practice. And so we can do some things to help regulate that and get that back on track so that it's making normal levels of hormones. Because again, that whole fight or flight triggering cortisol then has a downward cascade where it negatively impacts our other hormones. Another thing we can do is making sure we're syncing with our circadian rhythm. So one of the problems that you may hear about in perimenopause and menopause that you might be having is trouble with sleep. And so really paying attention to the lifestyle things we do that affect our sleep, our circadian rhythm can be very helpful. Also decreasing inflammation in our body. So this can happen through the foods we eat, the things we drink, the toxic chemicals we get exposed to, if we're smoking, things like that, all play a huge role in decreasing inflammation. And then also managing our blood sugar. So again, kind of quick overview, but when that nervous system is dysregulated, we're having that spike in cortisol that also affects our blood sugar and insulin levels. And then the hormone changes that we have on top of that in perimenopause and menopause make it harder to manage our blood sugar and our insulin levels. And this, for many women, translates to weight gain. I hear this all the time where women tell me, I haven't changed a thing. I still am exercising, I'm still eating healthy, and I can't lose weight, or I'm gaining weight and I've changed nothing. And that's literally because of those hormonal changes that are going on. Now, the reason why I'm breezing over those really fast is I'm deep diving into all these things in an upcoming 5-day workshop I've got planned for you. So it's called Exhausted to Energized for Busy Professional Women. And basically, that's a high level overview of what we're going to cover. We're actually going to deep dive in on all those topics over those 5 days, because those are actually the pillars of our program, our coaching program at Crown Executive Health, and the pillars of what we do with both our group coaching clients, our one-on-one clients, because it is so key for hormone regulation and feeling our best. So you are getting like a behind the scenes sneak peek. Basically, we're teaching you what we teach our clients in that 5-day workshop. So I'm going to put that link in the show notes or in the comments below, where you can sign up for that workshop. You don't want to miss it. My promise to you is that that workshop is going to be more helpful to you than your last 10 doctor's visits have been. I hear from women all the time. I just did a talk yesterday in a group, and so many women were telling me, yes, I've been to the doctor for the last 10 years complaining of these symptoms, and nobody's been able to help me. Nobody's been able to explain this to me. And so that's what I am hoping and bringing to you. I'm hoping that you get out of it, and that I'm bringing to you is just the answers for why the heck is my body not feel the way I want it to anymore? Why do I feel like I'm living in somebody else's body? That's what we're going to talk about. So make sure you sign up and you don't miss that workshop. Okay, so now let's dive into the actual supplements. What can we do to treat perimenopause? Okay, so I've got 9 supplements here that I'm going to talk through that you could integrate into your routine. Again, this podcast is not direct medical advice. You want to make sure you're consulting with some references with your doctor before you make changes. But we're going to talk about some supplements that could help and why they help. So the first one is vitamin B6. This is also known as pyroxidine, Pyroxidine. So why B6 helps is B6 helps in your when your body makes the brain chemicals, your body makes things like serotonin and dopamine and GABA, other neurotransmitters or brain chemicals. It uses B6 to do this. Now, I'm going to give you a caveat, especially if you are a woman who has been on hormonal birth control for years. The data actually shows that this can deplete. We see low levels of vitamin B6 in these women. So, and I just anecdotally, not necessarily in, research, but I have known and I've personally experienced when I have been on hormonal birth control, it has affected my mood in a negative way. So if you're somebody who maybe you are in perimenopause and you're on hormonal birth control, or maybe you've been on hormonal birth control in the past, and now you're experiencing some mood changes. This can be from changes in your hormones, of course, but then this can be even exacerbated if you have low B6 levels. So supplementing with B6 could help, particularly with mood swings that you could have in perimenopause. Now, the next supplement I'm going to talk about is magnesium. Everybody loves to talk about magnesium, and magnesium is like the wonder supplement and will cure all our ills, right? Magnesium is a mineral. Typically we get magnesium from the foods that we eat, but because of our farming practices, what we find is that magnesium content is actually much lower these days than it probably was in our grandparents' days. But magnesium does do a lot of things. Literally, there's hundreds of chemical reactions in the body that magnesium plays a role in. But here are some benefits of magnesium. So magnesium, we talked about that nervous system regulation. Magnesium can help with nervous system regulation and help promote sleep. Magnesium supplementation can help prevent migraines. We know that magnesium plays a role with our building bone and maintaining our bone health. So especially as we're entering into that perimenopause and menopause stage, we want to make sure we're maintaining our bone health to prevent osteoporosis and osteopenia. Magnesium plays a role with our thyroid hormones. Magnesium plays a role with metabolism of estrogen. So basically your body uses estrogen and then it's got to get rid of it. And magnesium plays a role in that. Magnesium plays a role in our absorption of vitamin D. Magnesium plays a role in our actual energy formation in our cells and the mitochondria. Magnesium can help lower inflammation and help with slowing the aging process. Magnesium can actually help with our insulin resistance and kind of that blood sugar insulin picture that we talked about. It can help improve those levels. So there's those are just a couple things that magnesium can be beneficial for if you are in that perimenopause state. I love magnesium even if you're not in perimenopause, but just to give you that. So the one thing you will see is there's many different forms of magnesium. My preferred form, or the form that I find is helpful for everybody overall, is magnesium glycinate or magnesium bisglycinate. What you do want to avoid, mostly if you're trying to get the actual increase your magnesium levels and get the magnesium into the blood, there are forms of magnesium that are not absorbed really well. It's magnesium citrate. You'll see that one used for constipation. Magnesium carbonate, magnesium oxide are magnesium forms that actually aren't absorbed well into the bloodstream, but they do help with constipation. So if that is your particular concern, magnesium, those forms of magnesium can help. But if we're looking to increase our actual blood levels of magnesium to have those effects we just talked through, something like magnesium glycinate or magnesium bisglycinate is more helpful for that absorption and the effect. I'm just not talking through because this can be nuanced. You can Google recommended intake levels, so like how much magnesium, how much B6 should you be taking. You can actually do a quick Google search for things like that, but I don't want to give specific recommendations because I might recommend one amount to one client based on their levels and another amount to another client based on their levels, right? So there again are generally recommended, it's by the USDA, I believe, There's recommended daily intake levels of vitamin levels that you can look up online. All right. So the next supplement is zinc. So what zinc can do, zinc can actually help with that dysregulated HPA system that we talked about. So again, we talked about that nervous system being triggered, cortisol being triggered, and that fight or flight, and kind of dysregulating that hormone cascade that happens, our HPA axis. And so zinc can play a role in improving that. Zinc can also play a role in decreasing inflammation. And zinc also plays a role, it's great for, I've said, internal and external skin. So it can be great for your hair, for your skin, but it can also be great if you are, the closer you do get to menopause, when you have those decreasing estrogen levels, a symptom that can show up is vaginal dryness. And so zinc could help with that, the skin that's in your vagina, and help with lubrication there. I'll just say my opinion with supplements they can be like a drop. I should have said this in the beginning, so I apologize. Supplements can be like a drop in the bucket. So if we're looking at, again, the workshop that we're doing, we're talking through the big lifestyle changes that make such a difference. If you are ignoring all of those and you're like, let me just take supplements for my perimenopause, you might not feel much of an effect, and you might go, well, this doesn't work, because there's all these other things that are off. There's all these other causation, whatever you want to call it, these other things, these other root causes that are contributing and exacerbating your symptoms. If you're just leaning to supplementation, you may not see the improvements. You really want to make that lifestyle, those lifestyle changes. And two, you may just want to end up going on HRT. That's an option too. So hormone replacement therapy. But make sure you don't miss that workshop, so that you get in on and you learn all this stuff. Literally, you're going to be able to walk away from that workshop and go, okay, this is what I need to do to take care of my body during this time of my life. Okay. Again, just a little plug for our workshop. I'm really excited about it because it's honestly like the biggest presentation that we've done, where we're literally teaching you everything, that we're not holding anything back. All right, so zinc supplementation we talked about. The next one is iodine. So iodine, we actually need a certain amount of iodine for our thyroid hormone to convert. So we convert our inactive, our T4 to T3 conversion. Iodine is involved in that process, just to give you high level. So we need normal amounts of iodine, or a certain amount of iodine, for normal thyroid function. But iodine supplementation, can also help decrease inflammation. It helps with normal estrogen metabolism. So we talked about that before, but again, your body being able to process and remove estrogen, and not let those estrogen levels build up. And where this shows up a lot is with breast pain and fibrocystic breasts. So even if you're somebody who is younger, you're not in perimenopause, and you have a lot of fibrocystic breast changes, and you have a lot of breast pain associated with your cycles, this could be a sign of iodine deficiency. So just that's something that you can get your doctor to test for. You want to make sure. There are people that supplement like really high levels of iodine. Too much iodine can actually induce autoimmune thyroid disease. So that in particular is a supplement you don't want to like willy-nilly supplement that, and just as a caveat. But iodine supplementation. Another one is vitamin E. So vitamin E can possibly help with hot flashes. So if you're coming into that, closer to menopause, you're starting to have hot flashes from the decline, decline in estrogen, vitamin E could potentially help. Now, I say potentially because when we look at medical literature, so you have these, right? Okay, I've talked about on the podcast before the weight loss injections, semaglutide, tirzepatide. What you have to understand about medical research is it takes money. We need money to do huge, large scale studies to see if something is effective. So who pays for these studies is the big pharma companies, right? Because, and I mean that in like, they're not doing anything wrong by doing that, but they're paying money to do studies to see if their drug works, right? And now there's more and more studies to see if they work for different things. So there's no big pharma companies that are behind a lot of supplements and things that are out there. So again, there's not a lot of money to do studies, large scale studies, to help prove what supplements are effective for. So you're gonna find that a lot of studies that are done on supplements are small scale. They are case studies. They're like, there was this, we found that 5 people who took this, had this improvement. They're not these big, again, large scale studies that are done on big, pharmaceutical drugs. We don't see studies like that. And unfortunately, it's because there's just not the money behind it to pay people and to pay for the studies to do that. So that's why I said that potentially vitamin E can help with hot flashes. Another one that's like that is something called bioflavonoids. So this is things that you probably have heard of. Quercetin. So quercetin I heard that all the time during COVID in the more natural space. Quercetin, rutin, and I believe it's pronounced hesperidin. Those are bioflavonoids. And so those are things that you'll actually see these when they're combined with vitamin C, they can potentially help with hot flashes. And you'll see these a lot of times in like immune boosting supplements. So like I said before, the vitamin C, the quercetin, you'll see those a lot combined together in immune boosting supplements. But they do have the potential to help reduce hot flashes. They can also help boost your immune system. So win-win. Another supplement that could potentially help with perimenopausal symptoms, I actually do use this one with my patients and with my clients, is evening primrose oil. So we actually do use this in some of our protocols. So evening primrose oil contains something called GLA, gamma-linolenic acid, and it is an essential fatty acid. And basically it can help to reduce inflammation, but it can also help with, again, that estrogen metabolism. So what I find, again, in our practice, in what the feedback that I get from what we find is that this does help with reduction in PMS symptoms. So it could potentially, if you're having, and it helps some with that estrogen metabolism. So if you are in that perimenopausal state where you're having low progesterone and you still have higher estrogen levels, you're more estrogen dominant, you're finding PMS symptoms worsen, evening primrose oil could potentially help with this. And I will tell you in particular, we use evening primrose oil during the second half of the cycle for our patients. And I have patients that have continued to take evening primrose oil even past, their recommended, kind of as maintenance, I guess I should say, because they find that it helps with their PMS symptoms so much. 2 more supplements for you. So one in particular is called Chasteberry or Vitex agnus castus. So this is a supplement you'll see if you are on the market looking for, in the market for a hormone balancing supplement. I hear from a lot of people the Happy Mammoth, right? Or there's all these, this is our hormonal supplement. It's going to, improve all your hormone symptoms. Could potentially see Chasteberry in there. It's a very popular supplement for hormone balance. And how Chasteberry potentially works is we see that Chasteberry can help promote progesterone levels. So again, that's a problem that we see in perimenopause, or our root cause is that we're having decreased levels of progesterone. So taking Chasteberry could potentially promote that progesterone and keep those progesterone levels up. I will tell you at some point, like your progesterone levels will just decrease. And so taking Chasteberry, as you go into menopause is just, it's not going to, your ovaries are going to stop functioning. So there's going to be no progesterone because the ovaries aren't releasing eggs. But as you're in that perimenopause state, you are still cycling. Chasteberry can be helpful. It can also be helpful again for even if you're a younger woman. So I see a lot of women that are not in this, in their 20s, in their 30s, and have low progesterone levels, especially my ladies that are wanting to get pregnant. When we take a look and we see, wow, they actually aren't making adequate levels of progesterone. So something like chasteberry can be helpful. So leading into that, you can also supplement progesterone. So progesterone is a potential conventional treatment for, or a prescribed treatment for perimenopause. I will tell you, there are not a lot of providers out there in the conventional medicine setting. So your primary care doctor, your OBGYN, there's not a lot of them that will prescribe progesterone alone. Most of the time, they're going to want to put you on combination. They're going to want to put you on birth control, or if you are in menopause, they're going to, and there are reasons behind that. But if you do have low progesterone levels and you're in that more estrogen dominant state in perimenopause, you're still cycling. Supplementing progesterone during, again, that luteal phase, the second half of your cycle, can be really beneficial. And I've actually done this myself, and I've recommended this for both my patients and clients as well. Just want to give you this caveat before I dive in a little more. This is something that you probably do want to get your levels checked before you'd be doing something like this. If you're getting prescription progesterone, right, that has to be from a doctor. Or a nurse practitioner or a PA. They're going to want to check levels before they prescribe something like that for you. But if you were taking, the prescription dosages are like 100 or 200 milligrams, you can get a topical progesterone. It usually comes in a cream or an oil that you apply. Usually you rub it on like the inside of your arm or your belly, just different places on your body, once or twice a day. And that dosage is usually around 40 milligrams topically. So I'm not telling you to do this, but yes, you can go on Amazon right now and look up progesterone cream and buy yourself some, and you can try it out. I would recommend maybe having a conversation with somebody, having a conversation with a provider before doing this, and really getting assessment of, do you have low progesterone levels before trying this? But there is, some people do use progesterone because low progesterone can cause migraines, can trigger migraines. There's some people that do use progesterone for migraine treatment as well. So again, this is not direct medical advice, but that is a potential out there that you could use. Either you could do a topical over-the-counter progesterone to help with those symptoms. And again, I do recommend that in my patients, but when we're looking at their labs and we're seeing what their values are before we do that. So that is our last. If you got value out of this, if you know a woman that needs to hear this episode, you know a woman that's maybe entering that perimenopause stage and she needs help, recommend passing this information on to her, forward this episode to her. Let's help each other get the answers, learn about our bodies, figure out what we need. There's so much confusion out there about health advice and what you should do, what you shouldn't do. And so that's my goal with this podcast, is just to bring the evidence, bring clarity, help you understand your body. And again, I'd love for you to join us in our workshop starting on the 28th. The link is below to register, and we will see you in the next episode.